Welcome back, everyone, to the deep dive. This time, we're taking a closer look at cholinergic-blocking drugs.
Really fascinating area, especially considering how these medications can have such a profound impact on different body systems.
You're right about that. And since our audience today consists of nurses and students, I think this deep dive is going to be incredibly relevant. It's like a supercharged review session, hitting those key points that'll help you ace your exams and, even more importantly, provide really great patient care.
Absolutely. We're going to break down those sometimes tricky mechanisms of action, go over practical applications, and even work through some case studies. All that to help solidify your understanding.
Sounds like a plan. So, to kick things off, what do these drugs actually do?
Well, in the simplest terms, they block the action of acetylcholine.
Okay, acetylcholine, that's a neurotransmitter, right?
Right, and it plays a vital role in the parasympathetic nervous system.
And that's the rest and digest system.
Precisely. It's responsible for slowing the heart rate, lowering blood pressure, increasing digestion, all those functions that help us conserve energy.
So if these drugs block acetylcholine, are we essentially putting the brakes on the parasympathetic nervous system?
In a sense, yes. It's like shifting the balance towards the sympathetic nervous system, the fight or flight response.
That's a great analogy. So by understanding how these medications impact that balance, we can really get a good grasp on their therapeutic effects.
Right, precisely. Let's consider something like bradycardia, that dangerously slow heart rate. By blocking acetylcholine's slowing effects on the heart, these medications can help bring the heart rate back up to a normal rhythm.
It's like taking the foot off the brake. Interesting. But as with any potent medication, there are always potential side effects and risks involved.
Absolutely. So before we get into specific drugs and their applications, let's ensure we're all on the same page with those key terms and concepts that'll build a solid foundation for our understanding.
Couldn't agree more.
Okay, so let's start with the term cholinergic-blocking drugs. Now, this basically covers all the medications that, as we've talked about, work by hindering acetylcholine. You'll also hear synonyms like anticholinergics, parasympatholytics, or antimuscarinics, but they all essentially describe the same thing, the same group of drugs operating on that same fundamental mechanism.
So it's like different names for the same tool in your nursing toolkit, right?
Right.
Got to know which one to grab when the situation calls for it.
You got it. Now, another term we need to talk about is mydriasis. This refers to the dilation or widening of those pupils. Now, I'm sure you know from your experience that pupil dilation can be a sign of many different conditions, so understanding how these drugs can cause mydriasis is really important for accurate patient assessment.
Makes sense. Those pupils can be a vital window into a patient's neurological status, especially in those emergency situations.
Exactly. And while we're on the topic of terminology, another term used interchangeably with cholinergic-blocking drugs is parasympatholytics. This term really focuses on the action of these medications. They reduce the activity of that parasympathetic nervous system. So if the parasympathetic system is about rest and digest, these drugs essentially lift the foot off the brake, allowing the fight or flight response to have a bit more influence.
So are we saying that these drugs kind of shift the body's internal balance towards a more, well, alert state? That's pretty fascinating.
You've got it. And understanding this shift is essential when we delve into the potential side effects of these medications. Some of them, as you'll see, relate directly to this altered balance.
This is where things start to get really interesting. It's like a domino effect, right? Block acetylcholine, influence the parasympathetic system, and then suddenly you have a cascade of effects throughout the body. It's like that saying when you hear hoofbeats, think horses, not zebras. You have to think about the whole system, not just the immediate target.
Absolutely. It really highlights why a deep understanding of these medications is so crucial, especially for nurses. You guys are often on the front lines, observing those effects and advocating for your patients.
Speaking of patient care, let's talk about the practical applications of these medications. What are some of the conditions we typically use them for?
Well, think back to the parasympathetic nervous system, the rest and digest system. Imagine scenarios where you'd want to dial down those effects a bit. Irritable bowel syndrome, where there's excessive gut motility causing discomfort, or an overactive bladder with those frequent urges to urinate interrupting daily life. These are great examples where cholinergic blocking drugs can be extremely helpful.
It's like using a volume knob to fine-tune those bodily functions that are a little bit out of whack.
Yes. Of course, the specific drug and dosage will always depend on the patient and the condition, but, the underlying principle remains the same. Target acetylcholine, influence that parasympathetic nervous system, and achieve the desired therapeutic effect.
Okay, that's starting to make a lot of sense. But with these powerful effects, I imagine there are also potential downsides to consider.
Absolutely. And that's exactly what we'll explore next, diving into the potential risks and cautions associated with these medications. Stay tuned.
We're seeing how these cholinergic blocking drugs can be real game changers when it comes to managing various conditions.
Definitely.
But I also can't help but think about those potential downsides. We can't just focus on the benefits without also thinking about the risks, especially when patient safety is on the line.
Oh, you're absolutely right. Just like with any potent medication, cholinergic blocking drugs come with their own list of cautions and contraindications. And for nurses, understanding these is absolutely vital, not only to prevent harm, but to really advocate for patients who might be more susceptible to certain side effects.
Okay, so let's get into those risks. What are some of the red flags that nurses should be watching out for?
Well, one of the most common side effects you'll see is dry mouth.
Dry mouth, huh?
Now, it might sound like a minor inconvenience, but for some patients, particularly older adults, dry mouth can really impact their quality of life. Things like difficulty swallowing, dental problems, even nutritional deficiencies can pop up.
You're so right. It's a good reminder to consider the individual patient, not just the textbook definition of a side effect.
Yeah.
What might be a minor annoyance to one person could be a really big issue for another.
Exactly. And another common side effect is constipation.
Constipation.
Again, it might not seem like a huge deal at first glance, but chronic constipation can lead to some serious complications, especially in those older adults who are already at a higher risk for bowel obstructions.
And it's not just the physical discomfort. Think about the impact on a patient's dignity and self-esteem when they're dealing with these kinds of issues.
Absolutely.
It really emphasizes that need for a holistic approach to nursing care.
I completely agree. Now, let's go beyond those more common side effects and look at the potential for some serious adverse reactions. Anticholinergics, you see, can actually impact the cardiovascular system, potentially causing tachycardia, that rapid heart rate, and even
Oh,
palpitations.
wow, that does sound a bit concerning.
Yeah.
So would we want to avoid using these medications in patients who already have heart problems?
Well, it would really depend on the specific condition and the individual patient's risk factors, but it's a perfect example of why a thorough medical history and assessment are so crucial before giving any of these medications.
And I imagine age plays a role too. We've talked about how older adults tend to be more sensitive to these medications.
Yeah.
Are there any specific age-related considerations that nurses should be extra careful about?
Oh, absolutely. Older adults, generally speaking, are more susceptible to those cognitive effects of anticholinergics. We can see things like confusion, sedation, even hallucinations, especially when we're using higher doses.
That's so important to keep in mind, especially with delirium being such a common and serious problem in older hospitalized patients.
Yes.
We definitely wouldn't want to make their cognitive function worse with a medication.
You're exactly right. And in addition to age, certain medical conditions can really increase the risks with these medications. Glaucoma, for instance, which affects the eyes, is one where patients should generally avoid anticholinergics.
I see. So those drugs could actually make the glaucoma worse.
Precisely.
I'm realizing how crucial it is for nurses to be like detectives, piecing together all those clues. Medical history, current medications, age, their overall health. It all helps to make sure these medications are used safely and effectively.
That's a fantastic way to put it. Nurses truly are the gatekeepers here,
Yeah.
advocating for their patients and making sure those benefits outweigh any potential risks.
Okay, so we've gone over some of the general risks and things to watch out for. Let's dive into some specifics now. Our source material provides detailed profiles of several commonly used cholinergic blocking drugs. Where should we start?
Let's begin with atropine. It's often considered the prototype anticholinergic.
Atropine.
It's been used in medicine for centuries. Initially derived from the Atropa belladonna plant, also known as deadly nightshade.
Deadly nightshade. That sounds a bit ominous.
It does, doesn't it?
I have a feeling it wasn't just used for medicinal purposes back in the day.
You're right to be cautious.
Okay.
Atropa belladonna does have a long and maybe a bit sinister history.
Uh-huh.
But when used correctly, atropine is incredibly valuable.
Okay.
It's used to treat bradycardia, reduce secretions before surgery, even act as an antidote for certain types of poisoning.
Sounds like it's quite a versatile tool in the medical world.
Absolutely.
But I'm guessing with that potency comes a whole list of cautions too.
Of course. Atropine, for example, is contraindicated in patients with glaucoma and should be used very carefully in those with heart conditions or urinary retention.
Got it. So definitely not a medication to be taken lightly. What about some other drugs in this class? Let's talk about dicyclomine.
Dicyclomine.
I understand it's mostly used to treat irritable bowel syndrome.
That's right. Dicyclomine, or Bentyl as it's marketed, works by relaxing those smooth muscles in the digestive tract. It reduces those spasms and discomfort that come with conditions like irritable bowel syndrome.
So it's like a targeted approach to calming down an upset stomach.
Precisely.
Are there any specific cautions with this medication that nurses should know?
Yes. Just like atropine, dicyclomine is contraindicated in patients with glaucoma, and it should be avoided in those with certain gastrointestinal obstructions.
Okay, so it seems like glaucoma is a common contraindication for a lot of these medications.
You're picking up on a key point there, and it really underscores how important it is to have a thorough medical history and assessment. We need to make sure we're not prescribing something that could potentially harm the patient.
Absolutely. Let's move on to glycopyrrolate. Now, that's a drug I usually associate with surgery.
You're on the right track. Glycopyrrolate, often called Robinol, is a synthetic anticholinergic primarily used to reduce secretions during surgical procedures.
Oh, okay.
Helps keep that airway clear, and it reduces the risk of aspiration.
So it's an essential tool for anesthesiologists and surgeons.
Absolutely.
But I'm guessing, like the other medications we've talked about, it also comes with its own set of cautions.
Of course. Glycopyrrolate shares similar contraindications with those other anticholinergics we've discussed, things like glaucoma, certain gastrointestinal or genitourinary obstructions. We have to be mindful.
Okay, so I'm noticing a trend here. Glaucoma keeps popping up as a contraindication for these medications.
That's a great observation. It really emphasizes the importance of that thorough patient assessment, doesn't it?
Definitely. Now let's talk about oxybutynin. This one, I understand, is a common choice for overactive bladder, something we know is particularly prevalent in older adults.
Yes, oxybutynin, which is marketed under brand names like Ditropan and Oxytrol, is a real mainstay in treating overactive bladder. It relaxes the bladder muscle, reducing those frequent and often urgent urges to urinate.
Well, given how much overactive bladder can affect someone's quality of life, especially as they age, it's good to know there are effective treatments out there.
Absolutely. But as always, we need to be aware of the potential side effects and those contraindications. Oxybutynin shares those common ones we've discussed: glaucoma, certain gastrointestinal obstructions, urinary retention. And it's important to note that older adults might be more sensitive to its side effects, especially those cognitive effects like confusion.
So careful monitoring and dosage adjustments might be necessary in those cases. What about scopolamine? That's one I usually think of for motion sickness.
You're right on target. Scopolamine, which is available as a transdermal patch under the brand name TransDermScop, is very effective for preventing motion sickness. Right. It works by blocking acetylcholine's actions in the brain's vomiting center.
Yeah, I've heard those patches can be lifesavers for people prone to motion sickness, especially on cruises. But any downsides to using them?
Well, while generally well tolerated, scopolamine can cause those common anticholinergic side effects we've mentioned: dry mouth, blurred vision, drowsiness. And it's important to avoid mixing it with alcohol or other CNS depressants, as that can increase sedation.
Okay, so caution is key, as always. And lastly, let's round out our drug profiles with tolterodine,
Tolterodine.
another medication for overactive bladder.
Yes, tolterodine, sold under brand names like Detrol, is another effective option for managing overactive bladder. It works in a similar way to oxybutynin, relaxing that bladder muscle to reduce those urges.
So are there any major differences between tolterodine and oxybutynin that nurses should be aware of?
One notable difference is that the dosage of tolterodine might need to be adjusted in patients with liver problems or those taking medications that affect liver enzymes. It's a good example of why it's so important to consider all of a patient's medical conditions and medications before prescribing or administering these drugs.
Makes sense. Now that we've gone through these different cholinergic-blocking drugs and their uses, let's shift gears a bit and talk about what nurses need to know to ensure these medications are being used safely and effectively.
Great idea.
Things like dosage calculations, routes of administration, all those important nursing considerations.
That's a great transition to the practical application of all this knowledge. Let's break down those essential nursing considerations. First and foremost, a comprehensive patient assessment is absolutely crucial before administering any of these medications.
Makes sense. Got to gather all the information we can to make the right decisions about treatment.
Exactly. This includes reviewing the patient's medical history, their current medications, allergies, and performing a thorough physical assessment. We're essentially looking for anything that might contraindicate the use of these medications or signal a higher risk for certain side effects.
We're back to being detectives,
Precisely.
searching for those clues to ensure patient safety.
Exactly. Now, once we've decided that a cholinergic blocking drug is appropriate for the patient, we need to think about the dosage and route of administration.
Right.
These can vary depending on the medication, the patient's age and weight, and how severe their condition is.
And this is where those nursing math skills come in handy. Accurate dosage calculations are so important, especially when you're dealing with potent medications.
Oh, absolutely. Even a small error in calculation can have big consequences.
Right.
Double-checking calculations and knowing those safe dosage ranges for each medication are critical steps in preventing medication errors.
And it's not just about getting the math right. We also need to think about the most appropriate route of administration.
Right.
Some of these are available in oral forms, while others might be given intravenously or even in those transdermal patches.
You're exactly right. The route of administration can impact how quickly the medication takes effect, how long it lasts, even the potential for side effects.
So it's a decision that should be made in collaboration with the prescriber, taking into account the individual patient's needs.
Exactly. Now, beyond those dosage calculations and routes of administration, there are some overall nursing considerations that apply to all cholinergic blocking drugs.
Okay, let's talk about those. What do we need to keep in mind to make sure our patients are getting the best care possible?
Well, one of the most important things is to remember that these medications can make it harder for a patient to sweat,
You okay?
which means they're at a higher risk for heat stroke, especially in hot environments or during strenuous activity.
That's a crucial point, especially given the aging population and those rising rates of heat-related illnesses. We really need to be educating our patients about that risk.
Absolutely. Another important consideration is that these medications can cause blurred vision, which obviously impacts things like driving and anything that requires good eyesight.
Right.
We need to assess our patients for any changes in vision and advise them accordingly.
So communication and patient education are key.
Exactly. Speaking of patient education, it's crucial to give our patients clear instructions about their medications, potential side effects, and when to call their healthcare provider.
Empowering patients to take an active role in their own care can really make a difference.
I completely agree. And this is especially important for older adults who, as we've discussed, are more vulnerable to those adverse effects.
Absolutely. Okay, so we've covered a lot about nursing considerations.
We have.
But I'm wondering about those real-life situations, where we have to apply this knowledge.
Sure.
Do you have any case studies that might help us bridge the gap between theory and practice?
You're in luck. Our source material includes a case study about a 53-year-old school teacher, we'll call her Jay, who's going on a cruise to Alaska with her husband. It's their 30th wedding anniversary.
Something nice.
She's excited about the trip, but she's really dreading getting seasick.
I can relate to that. Not a fan of rough seas myself. So how does she go about preparing for this?
Well, she talks to her doctor and gets a prescription for those transdermal scopolamine patches, the Transderm Scut brand.
Smart move. But before we dive into Jay's experience, let's remember the contraindications for those scopolamine patches. What are the red flags that would make this medication a no-go?
Well, as we've already discussed, glaucoma is a major contraindication for most anticholinergics, including scopolamine.
So it's crucial for the prescriber to rule out glaucoma before giving someone scopolamine patches.
Exactly.
Okay, so back to Jay. She puts on the patch 4 hours before getting on the ship, as instructed. That evening, at dinner, she and her husband are offered champagne as part of the celebration. She's feeling a bit drowsy, but thirsty. What do you think Jay should do?
That's a tricky one.
It is.
We know scopolamine can cause drowsiness, and mixing it with alcohol could make that worse.
Right.
It would be best for her to politely decline that champagne, explaining that she's taking medication.
Right.
This scenario really shows how important patient education and open communication are.
It's all about empowering patients to make informed decisions, prioritize their safety, even if it means skipping a celebratory drink.
Exactly. The next morning, while they're out on deck, Jay's husband notices something different about her eyes. He says, "Look at your eyes. Is that from that patch?" What do you think he noticed?
Well, we know that scopolamine, like other anticholinergics, can cause mydriasis, those dilated pupils. Maybe Jay's pupils are wider than usual.
That's a great observation. Mydriasis is a common side effect of scopolamine, and it can cause blurred vision and make your eyes more sensitive to light.
So what should Jay do about that?
Well, wearing sunglasses, especially when it's sunny, would help. It'd reduce that glare and protect her eyes from all that bright light.
A simple but effective solution. Now, later that day, Jay's feeling fine, thinks she doesn't need the patch anymore, and decides to take it off, thinking she'll save it for later if she starts feeling sick again. What are your thoughts on that?
That might not be the best idea. Remember, transdermal patches are designed to release medication continuously over a specific period, usually 3 days for transderm scalp. Taking the patch off early could mess with that controlled release.
Right, so it's really important for her to follow those instructions and talk to her healthcare provider if she has any concerns.
Absolutely. Now, before we move on, I think it would be helpful to go over some of those review questions from our source material. They're designed to challenge us a bit and make sure we've grasped those key concepts about cholinergic-blocking drugs.
I'm all for a good challenge. It's a great way to check our understanding. Let's do it.
Okay, great. The first question asks, the nurse is teaching an older adult patient about cholinergic-blocking drug therapy. What's an important point to emphasize for this patient?
Let's see. We talk about how older adults are more sensitive to these medications, especially their risk for heat stroke because of impaired sweating.
That's right. So the most important thing to stress for an older adult is to avoid being in high temperatures. This can prevent potentially dangerous overheating.
So the answer is avoid exposure to high temperatures. Okay, next question. The nurse is giving a cholinergic blocking drug. What contraindications should they assess the patient for?
This one makes us think back to those red flags we discussed, the conditions where using anticholinergics could be risky.
Let's see. We talked about glaucoma, acute asthma or respiratory distress, myasthenia gravis, and gastrointestinal or genitourinary tract obstructions.
You got it. Now, out of those options, chronic bronchitis, peptic ulcer disease, irritable bowel syndrome, and benign prostatic hyperplasia, which one fits those contraindications?
Well, benign prostatic hyperplasia, or BPH, can cause urinary retention, which could get worse with those anticholinergics.
Exactly. So the answer is benign prostatic hyperplasia.
On to question 3. This one says, when assessing for adverse effects of cholinergic blocking drug therapy, which drug effects might the patient experience? Select all that apply.
All right, let's remember those common side effects: dry mouth, constipation, blurred vision, and urinary retention. Now, looking at the choices, diaphoresis, dry mouth, dilated pupils, urinary frequency, and constipation, which ones align with those effects?
Well, diaphoresis, meaning excessive sweating, would be the opposite of what we'd expect with anticholinergics, and urinary frequency would also be unlikely.
You're right. Those medications usually cause urinary retention, not frequency. So the correct answers are dry mouth, dilated pupils, and constipation.
Okay, next one. It asks, a nurse is giving a cholinergic blocking drug to a patient with drug-induced extrapyramidal effects. What therapeutic effect should the nurse watch for?
Now, this one asks us to think back to how anticholinergics are used to manage those extrapyramidal symptoms often caused by certain antipsychotic medications.
Oh, right. Anticholinergics can help offset those movement-related side effects.
Exactly. So the therapeutic effect the nurse should be looking for is decreased muscle rigidity and tremors.
On to question 5. During the assessment of a patient about to receive a cholinergic blocking drug, the nurse will determine whether the patient is taking any drugs that may potentially interact with the anticholinergic, including which of these.
Now, this question is about drug interactions.
Right.
Remember how we talked about those additive effects when anticholinergics are combined with other drugs that have anticholinergic properties?
Yes, like amantadine, antihistamines, and tricyclic antidepressants.
Exactly. Out of these options, opioids, antibiotics, tricyclic antidepressants, and anticonvulsants, the most likely culprits for an interaction would be tricyclic antidepressants.
All right, next up is question 6, which is about those transdermal scopolamine patches. It asks, a patient is given a prescription for transdermal scopolamine patches for motion sickness during a cruise vacation. Which instructions should the nurse give? Select all that apply.
Let's think back to those key points about applying scopolamine patches: the timing, placement, how long to wear it, and rotating the application sites.
So the correct instructions would be apply the patch 4 to 5 hours before boarding the ship. The patch needs to be placed on a non-hairy area just behind your ear. Change the patch every 3 days and rotate the application sites.
You got it.
Okay.
Now let's try a dosage calculation. Question 7 says, the preoperative order for an adult patient reads, give atropine 0.5 milligram IV push at 11:30. The medication comes in vials of 1 milligml, How many milliliters will the nurse administer for this dose?
Right, time to put our nursing math skills to work. We need to figure out how much solution has the desired dose of 0.5 milligram.
Exactly. And since we have 1 milligram per 1 ml, to get zero point 0.5 milligram, we would administer zero point 0.5 milligram.
It's a pretty simple calculation, but as we said, accuracy is so important in medication administration.
Absolutely. Always double check your work. Make sure you're giving the right dose.
And last question. The nurse is assessing a patient who has a prescription for dicyclamine. Which condition is a contraindication to this medication?
This takes us back to our chat about dicyclamine.
Dicyclamine?
That anticholinergic mainly used for irritable bowel syndrome. Remember those specific conditions we highlighted that could make using it problematic?
Yeah.
Hypersensitivity to anticholinergics, glaucoma, gastrointestinal obstructions, and things like myasthenia gravis or paralytic ileus.
Right. And one of the answer choices lines up with those. GI-8-NE.
Exactly. GI-H&E basically means a lack of muscle tone and movement in the digestive tract. Dicyclamine, by further relaxing those GI muscles, could make this condition worse.
Wow, we've really covered a lot today, exploring all aspects of cholinergic blocking drugs, from their uses and risks to the crucial role nurses play in ensuring their use safely and effectively.
It's been a great deep dive.
Those review questions were a great way to test our knowledge. I feel like I've really gotten a good grasp of these medications and how they affect nursing practice.
I agree. It's been great seeing you apply these concepts. Now, before we wrap up this deep dive into cholinergic blocking drugs, I'd like to shift gears a bit and focus on the patient's perspective.
Yeah.
We've talked a lot about the pharmacology, the risks, those nursing considerations, but ultimately, it's the patient who is experiencing the effects of these medications.
That's so true. It's easy to get caught up in those technical details and forget that we're dealing with real people. Each person has their own unique needs and concerns.
Absolutely. Our source material actually offers some excellent guidance on patient-centered care. It stresses the importance of education and understanding the needs of older adults.
Okay, let's hear those recommendations. I'm always looking for ways to improve my patient care.
While clear and comprehensive patient education is absolutely key, patients need to understand why they're taking a medication, what side effects they might experience, and how to manage those effects.
Right, it's about empowering patients to be active participants in their own care.
Exactly. Now, one of the most common side effects we've talked about is dry mouth, right?
Right.
And this can be really uncomfortable, especially for those older patients. But there are things we can do to help manage it.
Oh, good. What advice can we give patients who are dealing with dry mouth?
Well, encouraging good oral hygiene is a good place to start. Regular brushing and flossing can help prevent dental problems, which dry mouth can make worse. We can also suggest they drink more fluids, use artificial saliva products, or even try sucking on sugar-free hard candy.
Those are really practical tips. I bet they can make a big difference for patients.
Absolutely. Another important thing to emphasize is being careful during exercise, especially when it's hot outside. We know these medications can affect the body's ability to sweat, which puts patients at risk for overheating and heat stroke.
That's important to remember, especially for older adults. Their bodies may not regulate temperature as well as they used to.
Exactly. We need to educate our patients about this risk and advise them to avoid strenuous activity during the hottest parts of the day, stay hydrated, and wear light, loose-fitting clothing.
It's all about prevention. Recognizing those risk factors and stepping in early can make a huge difference.
Now, another side effect we mentioned is blurred vision. This can be a real concern, especially for people who drive or need to see clearly for other activities.
Absolutely. It's a safety issue we need to take seriously.
We should definitely advise patients who have blurred vision to avoid driving or operating machinery until it goes away. They should also let their doctor know if it continues or gets worse.
Right. So good communication is key. Now, are there any specific considerations for older adults, especially those with overactive bladder? We know that's a common issue in this age group.
Our source material offers some great insights here. It points out that overactive bladder isn't actually a disease itself, but rather a set of urinary symptoms, like those sudden urges to urinate, frequent urination, and even waking up at night to go.
I can imagine those symptoms really affect an older person's quality of life.
Oh, absolutely. It can disrupt their sleep, make them less social, and just generally impact their well-being.
But is this just something that happens as we age?
That's a common misconception. While getting older can play a role, overactive bladder is not something older adults should just accept. There are effective treatments, and nurses can really help by educating patients about their options.
It's about being an advocate for our patients and making sure they know they don't have to suffer in silence.
Exactly. Another important point the material highlights is that many people, especially older adults, may hesitate to talk about overactive bladder because they're embarrassed or think nothing can be done.
I understand that.
Yeah,
But it also shows how important it is to create a comfortable and supportive environment where patients feel safe to open up about these issues.
I completely agree. The good news is there are a number of treatment options for overactive bladder. The best choice depends on the individual patient and what they prefer.
So there's no single solution that works for everyone.
Right. We have things like behavioral therapy, lifestyle changes, medications like those anticholinergics we discussed, and even neuromodulation therapy. It's about finding the right approach for each individual.
And patient education is crucial throughout the entire process.
Absolutely. We need to give our patients the knowledge they need to understand their condition, recognize those triggers for their symptoms, and develop strategies to manage them.
Well, we've really covered a lot of ground today looking at cholinergic blocking drugs from all angles. The pharmacology, the risks, what nurses need to know, and of course, the patient's experience.
It's been a fantastic journey. We've explored these medications in depth, gaining the knowledge and understanding to provide truly patient-centered care.
I feel so much more confident in my understanding of these drugs now.
That's wonderful to hear.
It makes me want to keep learning and growing in my nursing practice.
That's the spirit. And remember, pharmacology is always evolving. We have to keep learning to stay at the forefront of patient care.
That brings us to the end of our deep dive into cholinergic blocking drugs. We've learned so much, but there's always more to explore.
I encourage you to keep digging into this area of pharmacology. Look for additional resources and talk with your colleagues to expand your knowledge.
And most importantly, use this knowledge to provide the best possible care for your patients. Be their advocate and make a real difference in their lives. Until next time, keep learning, keep growing, and keep making a difference.